Thanks for that health tip. We appreciate those. Okay, we've relocated here to Vernon Place. We're in the radiology department, joined by Jill Post. Jill, what is that thing behind us here?
This is our 3D biopsy table. This is how we do biopsies on lesions that we see on 3D mammography or on calcifications that they see on the mammogram.
Now, when we were here, I guess it was a couple years ago now, the whole 3D thing was coming, but it's so talk about that for a second.
So in February we started doing 3D mammograms. It seems pretty similar to the patients. We do the same 4 pictures we've always done. We still use compressions, so their experience is similar. The difference is in how it takes the picture. The machine used to hold still, take one large picture of the patient's breast, all the tissue were stacked on top of itself. Now, what's called the gantry, tips to the side, sweeps across while it takes the picture, and it takes multiple angles of the same view.
Is that kind of way the CAT scan works? You're going to get
similar,
kind of like sort of slices?
Yeah, so once it reconstructs everything, the radiologist is able to scroll through the breast in 1 millimeter slices, similar to a CAT scan.
Okay, so that now helps if we find something, right? Then where's it go from there?
If the doctor sees something that he finds suspicious, a lot of the times they will go back for an ultrasound if it's a mass. If it's calcifications, we end up here.
Okay. Talk about that for a second. So calcification, that usually indicates or sometimes indicates that there could be a lesion there?
Sometimes. The calcifications are, there's all different kinds of calcifications. Some are obviously benign. They don't worry about those. Some are not sure. A lot of the times they'll err on the side of caution, take them out with a biopsy just to test them. 80 to 90% are benign even after the biopsy. There's a very small percentage that are cancer. We need to take them out and test them.
Okay. All right, so let me ask you about one thing. So I'm not a high jumper, but if I was, do I have to be a high jumper to be able to get onto this table?
No, the table does start down lower. It's still pretty high. We have a big stool for the patients to climb up on. But this table's made for them to lie on their stomachs, and their breast hangs through the hole in the table, similar to the one we showed the last time you were here. This is new technology. The positioning's the same.
So my head goes one way if I'm going on the right side, or the other way if I'm on my left side?
Yep, yeah. We can flip-flop the patients depending on which breast we're doing and which angle we're coming in at.
Okay, so how's it work?
Okay, so the patient gets up here. It's like a mammogram machine underneath here. There's a compression paddle, puts their breast in compression so that it does not move. The job as the technologist is to get the part that they want to see right in the center so that the radiologist can biopsy it. I have a sample breast in there, so we can take some images. I can show you what that looks like. So this would be the patient is laying on their stomach and she's in compression, ready to go.
Okay.
And
so where's the actual where's the radiation coming from?
The radiation's coming from this side.
Okay.
This would be the tube, it's called, and it shoots this way through the breast, and this is the detector. This new machine, this detector is actually the same detector that we have on the mammogram machine, so the quality of the images are the same as you would be getting in a mammogram.
So now how does it, okay, I'm seeing this just like the regular one, so how's it get into 3D? Is that thing going to take multiple angles too?
Yes, it's going to work just like the machine does over there. So I'll be able to show you that, show you the motion and how it works.
Yeah, I'm excited to see that.
Yes.
Yeah, let's try it.
Okay. So first I'm going to, for comparison, I'm going to take a straight shot, and then I'm going to take a 3D shot.
Well, let me get out of the way so you can do all that.
Okay. So this would be a regular straight shot that we would have done on our old machine. And the image will show up on the screen here. So this is what it would look like before. You can see there's a little mass here, if you can see my cursor there. But what you can't see is there are also microcalcifications hidden in this breast that maybe we saw on the 3D mammo. But if we'd come over here to do what's called a 2D, which is what we had before, you can't really see it. So now I'm going to show you the same position, only with a 3D. And I don't know if you were able to see that kind of rotate as it took the pictures, but it took them at different angles. It's going to process it, and then I'll show you the same lesion under 3D. So here, I'm scrolling with the mouse cursor so that I'm actually scrolling through the breast in slices. And if we get to the slice that has the pathology in it, here's our mass, here's microcalcifications that you cannot see in the regular 2D because we're only looking at a 1 millimeter slice of this breast right now. So we can clearly see what we need to take out versus maybe knowing where it was. If we want to go ahead and take a biopsy, we localize it with this. This is our target. If we were going for this little sweep of calcifications, and the little ones are usually the ones they worry about. So they could not see them here, can see them very clearly here. Our machine now tells us where they are in the breast, how deep they are, how close they are to the skin, how close they are to the other side of the breast, so that we know exactly where we're going to put the needle in and take those images.
So that's
Take those samples.
so that's going to help the doctor guide where the biopsy is going to be taken from?
Yeah, it's going to go to the exact location. And we have this little picture over here that kind of helps us visualize it also. This would be the needle coming in. The green circle is your lesion that you located. And all of these tell you different information. How far is the needle from the detector? How far is the lesion from the center of the needle? How far is the aperture of the needle, which is where it takes the samples from? It's kind of an open bowl. How far is the aperture from the skin surface? Because if you're too close to the skin surface, you won't be able to take that biopsy.
Okay.
So this tells you that you are good. You're in a good position.
Okay.
The needle isn't in there yet, but you know where it is, and you know that you will be able to take that biopsy.
Okay. So I noticed as the machine was taking that 3D image, it
Mhm.
was moving. This
Yep.
end of the machine was moving, so it was getting, as you mentioned, those slices
Yeah.
from a slightly different angle.
Yep, and if you heard it beeping, each time it was beeping, it was taking a picture. So this first one I took was one long beep, one long exposure. This one takes little pictures, and each time
Okay.
it beeps, it's taking a picture. It's not on constantly. It's dit, 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 and each of those beeps is a picture.
So can you show us the sample how you do the biopsy? Is that
Yes.
something we can see?
Yep, so I'm going to say that's a good spot. This is where I want to biopsy. We come back over here. I'm going to move my needle to where I want it, the stage for the needle, and then I will get the needle set up.
Okay.
We go through some testing processes with the needle just to make sure that it's ready to go. This down here, you see the yellow. So the yellow tells us that we are close to where we want to be. We hand dial it in. And we're going to get all greens. When we're at all greens, we know we are where we're supposed to be it's called pre-fire. The needle has a little vacuum in it, kind of sucks the needle back. We're going to fire the needle. What that does is pushes it through the lesion, under the lesion, it gets it to the final resting spot before it takes the biopsy. So if we do that, and then it's ready to biopsy. So I'm going to show you back over here. We usually take a picture before that. This will actually be what we call a stereo pair. It's going to take two different angles instead of all those little pictures. It's going to take two separate angles so you'll be able to see where the needle is in location to your lesion. this shows up as two separate pictures at two separate angles. We know our mass was here and our calcs were here. So here's our mass underneath the needle. It's hard to see because it's in 2D. This is, you'll be able to see the lesion right above your needle here. It's at an angle, so it's not going to show up right in the bowl, but it's going to be like right at the tip, and it's going to suck the tissue down. And so I'm going to take some samples, and then I can show you a picture of what it looks like after we take a sample. The radiologist would do that. He'd be sitting down in a chair under the patient. He'd be watching where it's going. Right now, I'm pulling the rest of the samples out that were in the needle. Just pushes through some saline to flush it out of the system.
So kind of the bottom line of all of this is going to help get exactly to where that has to come from, to where that sample needs to come from.
Yep, exact spot. So what I'll do is I'm going to pull my needle back a little bit. We're going to take one more image over here, and you'll be able to see that it was there and that it's gone.
Wow.
Okay, so let me
get out of the way.
I'm just going to back this up a little bit. So this is our pre-picture. Once it's done processing, we're able to come over here. We have a button that will take us to the exact level we were at here for our first picture. And so you'll be able to see we were lined up right there. Right there is where we took the sample from. I didn't take very many samples this time. I only took 3. They usually take 12. So we would take a little bit more of that slice. But you can see that I got into the lesion that I was over and took the same spot.
Wow.
At the end of this biopsy also, we would take those samples and we would go over and take an actual x-ray of them on our mammogram machine to confirm that we have the calcifications in it before that we're done.
So let me ask you sort of a technical or process question here.
Mm-hmm.
So if doctor, something showed up and doctor said, we better follow up. Do I need to ask for this specifically? Is this now the new standard, the way that we do it?
For calcification, this is the standard. If it's a mass, if they can see it easily on ultrasound, they'll do the biopsy under ultrasound. We've had some where they get under ultrasound and it's difficult for one reason or another. We can see masses in here now with this new machine, so we could do those biopsies here as well. This also has the capability of doing biopsies on very thin breasts, whereas before we didn't have that option. With our old table, we would have had to send them somewhere else or put them under ultrasound, and it limited our abilities. This opens up more than what we had before.
So now this is my words. So this is the latest and greatest.
Yes.
I mean, this is the new standard of care,
Yep.
right?
This is 3D mammography is the new standard of screening. This is the new best top of the line biopsy machine.
Nobody wants to be doing any of this, but if this does come along in your life or your family member, get it. My words, get it as quickly as possible.
Yeah.
You want to get that treatment rolling. You want to get that thing
Yep.
out of there, not growing, not spreading to other places. And right? Am I right about that?
You're right. And this biopsy is faster. We were in here before maybe for an hour with the patients. Now it's closer to a half hour. The actual biopsy itself is minutes once the radiologist comes in. Very quick procedure.
Okay, so does scheduling and all that kind of stuff, how does that work?
Usually if the radiologist finds that he's going to recommend a biopsy, the report will go out that afternoon or the next morning. The patient's doctor schedules them to come back. Usually they get back in within the week to have the biopsy done.
Wow. Well, Jill Post, thank you very
You're
much.
welcome.
Great new thing to have
Yes.
here available.
Mhm.
Okay, thank you for being with us today. Also, we appreciate Dermatology for the update on the new information on the new services available there. And thank you folks at home for joining us on Medicine in Meadville, and we'll talk to you next time.